Hello, ladies and gentlemen, distinguished participants of this very important VODAN-Africa conference that is taking place today. I send my regards and greetings from Kampala International University in Uganda and the entire Ugandan community. Today, ladies and gentlemen, I would like to recognize the participation of His Excellency Dr. Charumbira Fortune, the Honorable President of the Pan-African Parliament to the African Union. I want also to recognize the Chair of GoFair, Professor Dr. Barren Mons, and of course Professor Miriam Van Ryssen, who are all critical in the arrangements today. I also salute all of you in your various capacities. Thanks a lot for making time to this conference. I am the President and the Chair of the VODAN-Africa Board and also of the Implementation Network. I'm the Vice Chancellor of Kampala International University. I wish to raise your attention to the following issues as we attend this conference today. As we know, conventionally, digital data is the most important ingredient of science and a key component of a good health system. Us in Africa are of course disadvantaged, and this conference is going to highlight the benefit of the VODAN-Africa efforts to put us as key players in the digital data world. At Kampala International University and in our research and education hospitals, we want to be at the forefront of the digital revolution, but under two specific conditions. The first condition is that the data digital architectures should have the right ethical foundation. We all know matters that surround privacy and the laws for the different countries, and therefore to us it is important that we honor and recognize but also be compliant to all ethical considerations in dealing with matters of digital data, particularly in our health facilities. So this is the first condition. The second condition is that the digital data architectures should actually be fit for the African context and its perspectives. We know Africa is the continent of the future, and therefore we must address or do interventions that fit the African context, but in collaboration with other peoples of the world. This is why, for example, we decided to partner with the Leiden University Medical Center. We were inspired by the Leiden University Medical Center work on fair data, making data findable, accessible, under well-defined conditions. And these conditions make that fair data interoperable and also reusable. We thought, and indeed we were right, that this partnership would allow us to learn a lot on how digital data can be handled differently, and also we believed that we would be able to contribute to innovation in Africa. I am so happy that today we are amplifying this, the success story of the VODAN-Africa and the related virus outbreak data outbreak network. When the COVID-19 pandemic broke out, we realized that the African health systems were in a very big disadvantaged situation and really not ready to handle the pandemic. The systems were already fragile and very, very vulnerable, and therefore when it came to matter of data, the data was not usable in our facilities, coupled with a gap, the human resource gap in our analytical capacities to learn from our aggregated data. Therefore, Kampala International University decided to host the Virus Data Outbreak Network, which is really the flagship of the VODAN-Africa, in order for us to see how best we can deal with the pandemic, but using digital data. We were supported in the beginning by seed funding from our very great promoters, the Philips Foundation, and subsequently as a project, we received additional funding from Invest International, CodeAid, and GoFair. We also partnered with Stanford and their CEDA platform to make data fair. Ladies and gentlemen, Your Excellencies, our dear participants globally, it is with immense pride that I address this conference here today at the occasion of the deployment of a fair, ethical digital data infrastructure for patient records in health facilities in Africa. Initially, we targeted only 30 facilities in 3 countries, but we ended up with 88 facilities in 8 countries. I imagine this is something that we all need to applaud and clap for. Thank you so much. The reason is very simple. This expansion is a clear demonstration that Africa needs such systems, and where it can actually carry the ownership and control its data, while it's enabling collaborators to access the data, but without taking and migrating the data, but optimizing its use in a very ethical way, as I mentioned earlier. As the Vice Chancellor of Kampala International University and the Chair of the VODAN-Africa Board, I would like to congratulate the group of the African PhD researchers who have studied the problem and methodologically worked through the creation of a very innovative data infrastructure that fits the African context. Fair, it's ethical, and makes Africa ready for any subsequent pandemics. It's a lesson that we have learned, and I wish at this particular moment to congratulate everybody who has played a key role in enabling the success of this project. I look forward to your participation in subsequent VODAN-Africa meetings and activities while we roll out our fair data applications in order to enhance predictions and focus within the African continent of not only the COVID-19 pandemic, but the subsequent ones, while we remain fully in charge and in control of our own destiny. I thank you very much and have a very successful conference.